Hi everybody and welcome to our second module on teratogens. All the items listed on this slide are potential teratogens. In the first teratogen video I talked about drugs. In this video we're going to focus on these items here highlighted in red, and in a separate video I talk about torch infections that are dangerous during pregnancy. Let's start by talking about alcohol. If mothers who are pregnant consume large amounts of alcohol, this can potentially harm the baby. One of the main ways by which alcohol harms the baby is that it acts as a neurotoxin. There are multiple mechanisms of this effect. Alcohol can lead to cell death, failure of nerve cell migration, but through all of these effects, alcohol often damages the central nervous system of the baby, and therefore one of the main outcomes from mothers who drink during pregnancy is that their babies are born with intellectual disability. Now, in some cases, in addition to intellectual disability, the baby is born with other features of a syndrome called the fetal alcohol syndrome. So the fetal alcohol syndrome is intellectual disability from alcohol plus characteristic facial features and congenital heart defects and skeletal anomalies. So this is a picture of the classic appearance of a baby with the fetal alcohol syndrome, and there are three key findings. First of all, there is a smooth philtrum. So the philtrum is the groove from the base of the nose to the upper lip, shown here in the picture, and this is smooth in babies who have the fetal alcohol syndrome. Notice that it looks like there almost isn't a philtrum in this baby on the screen. In addition, these babies have short palpebral fissures. The palpebral fissures are the openings of the eyes, and these babies have a small opening of the eyes. And then finally, there's a thin vermilion border. The vermilion border is the upper lip, and the upper lip in this baby on the screen you can see is very thin and narrow. These babies also often have congenital heart defects. There are lots of different defects that can occur in children born to mothers who drink alcohol, but some of them are listed on the screen here. These include atrial septal defects, ventricular septal defects, and even tetralogy of Fallot. In terms of growth and skeletal abnormalities, basically these babies are just very small. If you notice that picture I showed 2 slides ago, the baby's head was very small, and babies born to mothers who drink are very small in general, and they often remain below average for height and weight throughout their lives. Sometimes these babies also have limb defects, so their fingers can be contracted, and sometimes they have congenital hip dislocations as well. Finally, let's talk about the central nervous system effects of alcohol. First of all, babies born to mothers who consume alcohol when they're pregnant can have structural defects of the brain. Basically, the brain is just smaller than it should be in these babies. That's an easy way to remember this. Basically, everything about these babies is just small. So these babies often have a small head, which is microcephaly, and they can have small other structures in the brain, like the corpus callosum, the cerebellum, and the basal ganglia. In the most severe form, these babies can be born with holoprosencephaly, where they have a single lobe of the brain. In addition, these babies often have abnormal reflexes, which can be detected at birth. They can also have hypotonia and cranial nerve deficits, and that can also be detected at birth. And then, as I said before, one of the major problems when mothers drink during pregnancy is that their children will have lifelong intellectual impairment with a reduced IQ. I'll finish our discussion of alcohol with this slide and talk about the timing of exposure. Babies that are exposed to alcohol in the first trimester are the babies that tend to develop the facial abnormalities, the brain abnormalities, and congenital heart disease. Remember, in the first trimester, the body is forming, so exposure to any teratogen at this period of time, including alcohol, tends to lead to structural abnormalities like the ones shown in this slide. On the other hand, exposure to a teratogen like alcohol in the third trimester mostly affects growth, because in the third trimester, the body has formed, the baby is just growing in size. So alcohol exposure in the third trimester mostly affects the size of the baby and the growth of the brain. And then finally, I just want to mention that intellectual impairment can occur in absence of the facial or brain anomalies. Remember that intellectual impairment is one of the major consequences of pregnancy-associated alcohol consumption. So just because a baby's born and doesn't appear to have any birth defects, it doesn't necessarily mean that that baby won't later in life show evidence of intellectual impairment. Now let's talk about smoking during pregnancy. There are 2 toxins in cigarette smoke that can harm the baby. First of all, there is nicotine, and secondly, there is carbon monoxide. Both of these substances can impair oxygen delivery to the fetus. This is what you want to know for step 1 of your boards. First of all, nicotine can cause vasoconstriction. This can decrease placental blood flow. And then carbon monoxide can compete with oxygen for binding to hemoglobin, and this can decrease the amount of oxyhemoglobin in the maternal blood. So by both of these mechanisms, less oxygen is delivered to the fetus during pregnancy. And if you understand that mechanism, it's very easy to understand the consequences of smoking during pregnancy. First of all, the baby will not grow enough. Intrauterine growth restriction and low birth weight are common among children born to women who smoke. In fact, 20% of cases of low birth weight babies are associated with smoking. In addition, because there's poor oxygen delivery to the placenta can become abnormal. Placental abruption, placenta previa, and premature rupture of membranes are all more common among women who smoke during pregnancy. Preterm labor is also more common among women who smoke during pregnancy. And then finally, there's a well-documented association with sudden infant death syndrome and mothers who smoke during pregnancy. SIDS is when babies die during their first year of life, often in their sleep, and there's a well-documented association of this with smoking during pregnancy. Using cocaine is also dangerous to the baby during pregnancy. Just like nicotine, cocaine causes vasoconstriction, and therefore the effects of cocaine on pregnancy are similar to those of smoking. Babies born to mothers who use cocaine are often small with low birth weight, and there's an increased risk of placental abruption, preterm birth, and even miscarriage. Mercury is a potential teratogen. Mercury is a metallic element. This is a picture of liquid mercury on the screen here. And it's found in fish and seafood in the form of methylmercury. Methylmercury is mercury bound to a methyl group. This is found in fish and seafood, and it's not removed by cooking. And the highest levels are found in swordfish, shark, tilefish, and mackerel king. This is a picture of a mackerel king at the bottom of the screen here. And it turns out that the fetal brain is highly sensitive to mercury. The mother is usually not affected. So if a mother eats lots of these type of fish during pregnancy, the baby can potentially be harmed. This often results in developmental problems where the child grows up with delayed milestones. Rarely, it can cause severe problems like blindness, deafness, or cerebral palsy. So women who are pregnant often try to avoid eating fish for the fear that some types of fish contain mercury. X-rays are another potential teratogen. This is somewhat controversial because there is no evidence of harm at small doses, and the threshold for harm, meaning the amount of X-rays it takes to harm the baby, has not been definitively determined. Most sources agree that higher dosages at 8 to 15 weeks can potentially cause intellectual disability, microcephaly, or growth restriction. Most of these data are based on women who were pregnant and survived the atomic bombs in World War II. Based on those data, we think that high dosages of X-rays are harmful at this period of time. And because of this, lead shielding is usually used to protect the fetus if the mother requires exposure to X-rays. So for example, if a mother has a respiratory infection and needs to have an X-ray of her chest, a lead shield, like what this man is wearing here, will be placed over her belly, and X-rays cannot penetrate lead shielding, and therefore the baby will not be in any danger. Now let's talk about problems among babies when the mother has diabetes. There are multiple effects of maternal diabetes on the baby. First of all, this can lead to increased growth. Remember that glucose is fuel for growth of the fetus. So if the mother has diabetes and her blood sugar levels run high, the baby can get very large. In addition, the baby can have blood sugar alteration problems with high or low blood sugar. In addition, there's a higher risk of congenital heart disease and CNS disorders. And all of these adverse effects are related to the severity of the diabetes. So if the mother keeps her blood sugar well controlled during pregnancy, these effects are very unlikely. Mothers who poorly control their blood sugar have a much higher risk of abnormalities in the baby. So the first potential effect of maternal diabetes is macrosomia, which basically means a large baby. Children born to diabetic mothers are often large for gestational age. Their weight is often greater than the 90th percentile, and these babies are often greater than 9 pounds at birth. The usual weight for a baby at birth is about 6 or 7 to 8 pounds. 9 pounds or greater than 10 pounds is an enormous baby, like this child shown on the screen here. And because these babies are so large, this can potentially lead to birth injury during delivery. Sometimes the babies suffer what is known as shoulder dystocia. This is where the shoulders cannot pass through the birth canal. It can be difficult to get the baby out, and sometimes an emergent C-section is required. Another problem that occurs among babies born to diabetic mothers is neonatal hypoglycemia. So in the womb, if the fetus is exposed to high levels of blood sugar from the mother, the baby will begin making lots of insulin. This is called a hyperinsulinemic state. After birth, however, the baby no longer needs all that insulin, but it's still circulating and being generated. So in the first 24 hours or so of life, blood glucose levels can get low, sometimes below 40, which can potentially cause a seizure. Now, this is transient. It usually resolves after about 24 hours, and because of this reason, if the mom is diabetic, the baby needs close glucose monitoring after delivery. Congenital heart defects occur in 3 to 9% of babies born to diabetic mothers. There are lots of different heart defects that have been described, but the classic one you should remember for step 1 of your boards is transposition of the great arteries. This is associated with maternal diabetes. In addition, all of these other defects I've written on the screen here can potentially occur. There is a congenital anomaly called the caudal regression syndrome. It's also called sacral agenesis. This is a rare congenital abnormality but it's much more common among children born to maternal diabetics. It's classically associated with maternal diabetes. Usually it occurs in children of insulin-dependent mothers. In this syndrome, there is incomplete development of the sacrum. This can lead to what's known as sirenomelia, which is the mermaid syndrome, where children are born with fusion of the legs. In addition, they can be missing the bones of the sacrum, and it also includes a neural tube defect in many cases. So you can basically think of that lower pelvic region as being entirely abnormal. So the sacral bones are missing, there may be a neural tube defect, and the legs are fused together. On the left side of the screen is a baby with sirenomelia. You can see that the legs are fused together. On the right side of the screen is an X-ray of a child with sacral agenesis. You can see that the bones in the bottom of the pelvis are very, very small. This is because they have not grown normally. The last topic for this video is phenylketonuria. Patients with phenylketonuria cannot metabolize the amino acid phenylalanine. I talk about this disorder in detail in the biochemistry video on phenylalanine. But for our purposes here, you should know that if a mother has phenylketonuria, her baby is at risk because if she consumes phenylalanine, she cannot metabolize it, and high levels of phenylalanine act as a teratogen. So during pregnancy, women who have PKU have their phenylalanine level monitored and it needs to be kept normal, and dietary restriction of phenylalanine is essential during pregnancy so that the levels don't build up and harm the baby. You can think of the effects of phenylalanine on the baby as similar to those of alcohol. That's an easy way to remember them. So babies born to mothers with PKU can be small, they can have intrauterine growth restriction, they can have microcephaly, they often have intellectual disability, and in addition, they often also have congenital heart defects. One of the common congenital heart defects in babies born to mothers with PKU is coarctation of the aorta. They also often have a rare congenital heart syndrome called hypoplastic left heart syndrome. And that concludes our second video on teratogens.